My name is Dr Boselli. I work in 3 offices at my practice. My primary office is in Concord. I see patients in Derry and Windham. My practice specialty is sports medicine, and my personal practice focuses on shoulder and elbow surgery as well as knee. I'm actually originally from New Hampshire. I was born in Bedford. I went to school in Bedford my whole life. I went to Manchester West High School. I left for all of my training, so I went to college at the University of Notre Dame. I went to my medical school training at Georgetown in Washington, D.C. My residency training was at the University of Pennsylvania, and then my fellowship was in shoulder and elbow surgery at Columbia University in New York. And then I eventually migrated back to New Hampshire, kind of came full circle, and then joined Concord Orthopaedics. My clinical and surgical interests are primarily in shoulder and knee surgery. So I'd say probably about 70% of my practice is shoulder surgery, probably about 25% knee surgery, and the remainder would be other things, elbow procedures and some occasional other sports procedures. The things I love doing the most would be any sort of rotator cuff surgery, shoulder instability procedures, shoulder arthritis, any sort of shoulder reconstruction or revision reconstruction. I also do knee procedures like ACL surgery, meniscus, and stabilization type surgeries. I went into medicine, and specifically orthopedics, probably like most physicians, to help others. And specifically in orthopedics, I think we have the benefit of taking care of very motivated, oftentimes very healthy patients who really have a desire to get their quality of life and function back. I was drawn to shoulder surgery primarily because of the ability to maintain not only a practice in a more kind of open, involved reconstructive surgery, something along the lines of replacement, but also to take care of, a little more of the athletic population, patients who dislocate their shoulders, patient with rotator cuff tear. So I really get a lot of variety in patients' ages and activity levels, and that's what I love most about it. My practice philosophy is really to be a doctor first and a surgeon second. I think a lot of patients get nervous when they come to see a specialist is that they're immediately going to get referred for some sort of procedure, and that's really not the case. You got to know your patient, you got to know what level of function they're hoping to get back to, and the vast majority of what we do is non-surgical treatment for conditions. Outside of practice, I'm a college football fan, so I'm a Notre Dame fan. I really enjoy that in the fall. I love sailing, love to play tennis, spending time with my dog.